Of course, we were doing that up on the. We're not doing that on the common carotid, right? We're just doing that on the internal.
Right, I was
external.
just showing you the different approaches.
Okay. I was just,
All right, somebody got to tell me the protocol, the pictures, because I don't remember them, but I'll try. Okay, so I start at the clavicle. If I angle down my beam towards the clavicle, that's the subclavian right there, I can tell. Probably the vein down here.
okay.
So you're angling posterior to get that view?
I'm sending the beam
Under the clavicle.
in
Or
superior,
inferior? Yeah, that's
yeah.
what I meant.
Mm-hmm. Yeah, I can't tell if that's the vein or the artery. It's just the artery, actually. Yeah.
Oh, but it shows it longitudinal, right?
It will show it longitudinal because it's going towards the
angle.
arm.
Okay, right.
So I'm going to start here. I'm going to put that in the middle so I have my, let's see if I can find a caliper. I have my common and I have my jugular. See how the common's not very clean right there? So I can try to move around if I want. I want to keep good contact. That's not good contact right there. It's jelly. Alright, so then I'm just gonna move cephalad up towards the bifurcation. And now the bulb is coming. Not very pretty from this approach.
And that's
And then I have the bifurcation. It just depends on everybody. Some people have beautiful interior, some people have better lateral. It just depends on their muscle. Plus, you're kind of straining to see because you're looking at it, so that sternocleidomastoid muscle is in the way.
right.
So there's the bulb and there's the bifurcation.
So it's this and this.
Correct. And I'm going to go all the way up to the mandible as far as I can, and they disappear. Okay? I come back down the neck. And I'm going to go longitudinal. Oh no, then I would do my freeze it. You know, get my anterior approach.
Oh, with the internal and external.
So freeze that, label it. Then I would come around and do more of a lateral approach. I need more gel.
So I'm going to be doing.
Meg likes the gel. It's
I'm probably really dry. All this cold air
I know.
making me dry.
So when you start the sweep, do you want to see where the subclavian branches in that image, or
I
just
go
right
all the
above
way
it?
to the clavicle. Everybody will be different.
I think it was
You may
an
see
optional
you may
thing
not.
on there, right? To try to see it anyway. Or maybe not optional,
Not all-
but like you may or may not see it.
Your most proximal portion of your common is at the origin, and that's going to be down by the clavicle. Some people you may see subclavian, some people you may not. And then I'm going to come more lateral, and then I'm going to come more posterior.
We're doing a frozen of each of those.
A frozen of each of those. Okay? Alright? And then I'm going to go longitudinal. I'm going to start down by the clavicle as proximal as I can get. I'm going to check the different approaches to see which is the best approach. Become more lateral on her neck. And I'm going to come more posterior on her neck. And make sure you try to open up your vessel end to end so you're not what we call obliquing it, cutting it off. It's very bright, so you're going to bring down.
How do you not do that? Because I was having a hard time when we were doing
Obliquing it, you got to
Yeah.
twist and turn your probe. Like this is the, towards the feet,
So not like rocking, but moving it.
like this.
Okay.
Like if I do this, I'm obliquing this in.
Okay.
This is towards the head, so I'm going to bring this out
Okay.
to open that up. I'm going to put it on. There, that's better.
What are you changing?
I put on harmonics, Jen.
Jugular's
Oh.
compressed, right?
Right there, right.
Okay.
When you were in
partially.
transverse earlier, was the notch toward the her left?
Patient's right.
Oh, okay. I thought you had it that way.
This is her right.
This is my right.
I
Yeah,
did this
I
way.
thought you. Okay, sorry, I couldn't see the.
All right. So, so you want to take your pictures and the approach that's best for that vessel. I want to see all the way down towards the clavicle if possible. And I can tell if you're proximal by the way the vessel shape's coming off the arch. And then as you move up, it kind of becomes more parallel to the screen.
So the fact that it was kind of tapering there, and you know that you're in the right position, so that's how you know you're proximal? Or how you can tell we're proximal?
Yes. And then this is distal towards the bulb, and it starts to bulb out. You want to keep this open. See, I could easily start obliquing that.
Right.
You want to, that looks like a clot, thrombus or plaque. So you want to keep that open. You're going to move up. Where's my overall game? And then I'm just going to rotate. I don't know what the next image is I'm supposed to show you.
Let's see.
ICA, ECA?
Well, the first one under the longitudinal is the proximal common carotid artery with IJV with color.
Okay, well that would have been down towards the proximal.
But you just would have put
right,
color on.
Just put color on. And then this is your bulb area, and this is your proximal ICA. And then if I want to go to, I'm trying to show color compares on this machine.
Like the inferior lateral.
Yeah, that would be good to know. 'Cause I don't remember seeing it, but I wasn't looking for it either.
Colors up here, sorry. My nails are not conducive for
Touchscreen.
touchscreen at all. Steer. Help me out. Who's a knobbologist? Here, steer.
Alright, so that's where you start your flip.
Okay. Oh, I gotta turn it. Turn it. Here we go. Alright, so then I can follow. Oh, color compare. Color compare is right here on the color screen. Then you go to color, you'll see it.
Oh, okay.
So there's my ICA. And see, the B mode's not optimized. So it's not the best. So you may want to take one picture of your B mode and one picture of your color, just depending on your patient.
So color compare only if it looks pretty.
If it's readable. Yeah, if I can actually see it. That's not bad, but it's not ideal.
What is the darkness on both of them? Is that the,
Please don't put a pin on the
sorry,
screen.
is that the jugular?
Yeah, that's jugular. It may be a little jugular coming in because I see color. And then I can go back to the bulb and then go more medial. I'm just shooting the beam more towards her nose. So lateral down towards her ear, shooting the beam is more ICA because the ICA sits more posterior lateral and the ECA sits more anterior medial. So I get a little bit of ECA here, but I may have to slide more anteriorly. Oh, that was a good one too. More anteriorly to bring in a better ECA. This is all ECA right here that I didn't see from the more lateral approach.
You can tell that because it's duller too with the color.
Not duller,
More pulsatile?
more pulsatile.
Okay.
And this is the ICA. See the bulbous of the ICA? Generally the bulb is continuous with the ICA, but not always. And this is the ECA. See the difference?
Yeah.
So if I put on spectral, update choice.
I don't think this knows to go into though. It doesn't know that we're still
See how that's frozen? That's what I was talking about the update, so I could do simultaneous. And I have real-time B mode.
So you make sure you're still in the right position.
And then if I rotate, now I'm in the ICA. And it's a different sound and a different waveform. So that's ICA.
ICA's got the bulb, right?
9 times out of 10.
Okay.
On her, yes. And this is ECA. More
But
high
you see that
upstroke.
dichrotic notch, right?
Should. Not on everybody. You may see a little flow
Well,
reversal.
and it's going to be lower towards the baseline too.
Yes. More high resistance. Okay. Uh-oh. Can I get the 2D?
So do I just
2D.
take a transverse, pick up
So I see if I come more anteriorly, because the vertebrals sit really posterior, if I shoot my beam from anterior to posterior, I should start seeing some vertebral processes, and there's the vertebrals.
Easier to see the color, right?
Yeah, but you got to be able to identify them with B mode first.
Sure.
So what am I doing now?
So there's the vertebral. So and you can see the common above it for reference that the flow is going in the same direction.
Right.
So we have vertebral vein and artery. Artery's pulsating in red, the vein is in blue. Cool. There's the common. So that the direction, flow direction. So the anterior approach is usually a lot nicer to get those vertebrals. Anything else, Joyce? Anybody? So to get the subclavian, I would start at the clavicle. This is the right side, isn't it?
Yep.
I lied to y'all because I forgot about the innominate over here. So this is the innominate. I
Oh,
believe.
right. I forgot about that. Okay.
Let me see. Let me find the common. I follow the common. This is the common. I'm going towards the feet. Yeah, see how it's diving down? So that's the innominate. The
Right there.
Yeah, the common carotid is going to shoot off that way, and the subclavian is going to come up right here. Yeah, there's subclavian. See how?
Oh, right here? Okay.
And see how it's alusing because it's a higher velocity vessel.
It's
So
much
we
bigger.
would need to
Is this
change
the
the
CCA
scale.
up here?
I'm going to bring the scale up. No, the CCA will be over here shooting off. So I'm going to put
Okay, I
that.
see two is one of.
Hold-
Which one
wait,
is what?
Hold on.
This is subclavian
This is
down here.
subclavian. This is subclavian.
Oh, I thought this was subclavian and this was the innominate.
No, innominate is here and it
Oh.
branched off to subclavian and
I
CCA.
see.
What's below the
Hold
subclavian?
on just a
Oh,
second.
sorry.
Y'all ask me way too many questions at once. Yeah, I had to double check myself to make sure. Let me go back to B mode. Okay, so here is your. Let's see. Okay,
So the bigger one is going to
here's your common, right? Follow the common because the innominate divides into the what?
The common and the subclavian.
Right. So if I follow that down, then this is going to be a innominate coming off the arch. Subclavian is going to go towards the arm, and common is going to come up here.
So what was the vessel below the subclavian?
It could just be a mirror image. I
Well,
don't.
what is a mirror image?
It's an artifact that you haven't learned about yet.
Okay.
Yeah, because the innominate
'Cause it
sort of
looks
just
like
becomes the subclavian, right? It's not
Right.
like a.
It's kind of a division. It's kind of like a branching. It's like it stops and it goes one way to the common, to the head, and one way to the arm.
Okay, but
like
yeah,
a
so the
branch.
common comes off here, and then this becomes
Right.
subclavian.
Because see, here's the innominate. Here's a little bit of subclavian.
So once
and this
you-
is common.
Right. Okay. Yeah. Since once that's come off, then it's subclavian.
Yes.
Okay. I understand.
But see, now I don't see that. It's just a artifact. It's like a reverb, like a mirror image of what you would see because we probably could use a higher frequency on her if we had
So
it.
the common's like back here somewhere.
The common is up here. It goes more superiorly
Right.
that way.
And the innominate is always going to be angled
Let me show
down.
you. There's
down.
the common
Yeah.
right there. There's the subclavian. Yeah, that's just a mirror image. I think because we could use a higher frequency on her if we had it, but I don't think we have one.
yeah, so I don't have to put it all right there.
Well, yeah, we're on. It says we're on gen, right?
Yeah, that's a mirror image. You'll learn about that. But this is the true vessel. You're like, what's that? I'm like,
I got some extra.
That's a
stuff.
subclavian. If
That's
it
the
doesn't
subclavian.
have a spectrum, it's not a real thing, right?
No, it has a spectrum.
Oh.
But it's a fake spectrum. It's a phony. See? But I can't figure out on this machine why it doesn't have res on this. Why we can't get res. That's like.
Maybe it's
Oh,
because
maybe
the
this-
preset. It doesn't let it do.
No, it shouldn't be the preset. It should be. Oh, that's real slow. That I do. I don't understand that. I'm gonna have to come.
So that's harmonics is the
Anterior
Because that doesn't make sense to me. You don't push. You can't. It's either harmonic gen or
or gem,
I think it's
and
this.
that's it.
I don't think this is the. I don't know. This might be the leg transducer.
There's a leg one separate than the.
They're all flat linears, but it's a 8-4, and I think they have a 12.